In the last 24 hours, we have confirmed 64 new cases of COVID-19, bringing the total number of cases in Alberta to 754. This number of 754 includes 77 cases involving healthcare workers, including staff in continuing care facilities. The vast majority of these cases were returning travelers or participants at the bonspiel that I have previously talked about, not cases that were acquired while they were providing care. We continue to refine reporting for healthcare workers, and we will report new information as it becomes available. Sadly, I was just informed of an additional death reported in Calgary Zone at Mackenzie Town Long-Term Care. On behalf of all Albertans, I convey condolences to this individual's family. This is another tragic case of COVID-19 at its worst. We suspect up to 75% of all of the 754 cases that I talked about, our total in Alberta, are the result of community transmission. This is concerning. Alberta Health is tracking outbreaks in 3 facilities at the moment: Mackenzie Town Long-Term Care and Care West Glenmore Park Centre, both in Calgary, and Shepherd's Care Kensington and Edmonton Zone. Updates on confirmed case numbers at these outbreaks will be provided tomorrow to ensure we have the most accurate information available. These outbreaks remain worrisome. We know seniors and those with chronic health conditions are at greatest risk of severe illness related to COVID-19. We must all continue to do our part and follow the public health orders that are in place to save lives. Following the public health orders, though, does not mean we can't continue to support each other or to help the most vulnerable. Albertans are known for this generosity. Organizations like Alberta Food Banks and Meals on Wheels still need Albertans' support. I encourage healthy Albertans to give of their time where possible and with proper attention to physical distancing and hygiene requirements. Albertans can also help by donating blood through Canadian Blood Services. I understand that donations have declined, and we still need blood to help Albertans who are suffering through other health conditions. Canadian Blood Services has taken safety measures to ensure that their staff and their donors are protected in this time. We are all in this together, and now more than ever, kindness matters. In the coming days, we will be putting together some guidance on how community organizations and not-for-profits can continue to work while keeping their staff, volunteers, and communities safe. Even if you are not able to volunteer, there are things you can do to help others get through this. Reach out to friends, family, and neighbors who may be struggling. Even small gestures can go a long way. Last night, I read about someone who was out on their balcony shedding a few tears, and a neighbor from another balcony overheard and called out, "It's going to be okay, I promise." Or how a Calgary flower shop, despite having to close, donated flowers to help brighten the day for residents and employees of a continuing care facility. Or a wardrobe department of a filming company that was sewing hospital gowns in Calgary. Every day, I am overwhelmed by the compassion and generosity shown by Albertans. These small acts of kindness are making things a little bit brighter during these difficult times. During this time of necessary physical distancing and self-isolation, it is important that we still stay socially connected. Last week, I joined Premier Kenney for a telephone town hall with religious and faith leaders in the province. This provided an opportunity for discussion about the many religious commemorations just around the corner. Several leaders shared their own ideas on innovative ways to deliver services, such as through webcasts, teleconferencing, texting, and social media. All demonstrated an understanding of mass gathering restrictions and a willingness to reach their faith communities to offer ongoing support and fellowship. One Central Alberta church has decided to offer Easter services as a drive-in where families can listen to the service from the safety and comfort of their own cars. We must continue to find new ways, innovative ways, to connect with one another while being physically separated. This is true for families and friends who are planning to celebrate upcoming religious holidays such as Easter, Passover, and Ramadan. Albertans should be planning to celebrate virtually, not having large gatherings, and even avoiding smaller gatherings outside of their immediate household. The aggressive public health measures we've put in place are critical to protect the health of Albertans. We are all in this together,